New results from the Ebola drug Remdesivir. It's being tested in clinical trials to treat coronavirus, and patients in Chicago were given the medication and then discharged just days after being admitted to the ER. Gio Benitez has more on the potential breakthrough. Good morning, Gio.
Hey, George, good morning. Yeah, the University of Chicago is calling this a work in progress, but already some medical experts are saying this clinical trial is very exciting. This morning, doctors at the University of Chicago say one drug may be causing rapid recoveries in COVID-19 patients. The university hospital says Remdesivir, a medication originally developed to fight Ebola, is showing promise, reducing fever and respiratory symptoms, with many patients apparently discharged just days after being admitted to the ER.
Remdesivir has shown promising results, very promising, in compassionate use settings.
Reports say that 113 patients showing severe symptoms were brought into the trial. Nearly all of them have been taken off ventilators or discharged. Only 2 of the patients have died. The university is urging caution, saying this is only
48 hours.
Remdesivir, which he says finally saved him.
I think within 48 hours, I was feeling a lot better than where I was. I think that Remdesivir gave the extra jump start or kick start or whatever I needed to kind of turn that corner.
Now, if this is proven to be both safe and effective, this very well could become the first approved treatment against this disease. And Michael, we will be following that.
Yeah, we will be following that without a doubt, Gio. Thank you so much for that. Thank you so much for that. Our chief medical correspondent, Dr. Jennifer Ashton, joined us now. And Doc, it's been called a work in progress, but what's your take on Remdesivir? What do you think about this report?
Well, let's do a little Remdesivir 101, Michael. First of all, this is an intravenous drug that failed against Ebola, but in a lab setting, it has shown some efficacy against SARS and MERS, which are in the coronavirus family. Whenever we look at data, like Gio mentioned, we normally have to compare the standard of care with placebo versus the investigational drug. They did not test Remdesivir against placebo, and in terms of the numbers, they had about a 1.8% fatality rate. So again, you have to make sure that a drug is safe and effective in this setting. So they're testing it in moderately and severely ill patients. And right now it's in clinical trials all over the world. It is in short supply, although the company is manufacturing and ramping up production, but it is not available at every hospital yet, Michael. But some infectious disease specialists that we're speaking to are cautiously optimistic.
And there's so much going on with the testing for the coronavirus. The saliva tests are now being used in New Jersey, the FDA approved, but there's also some new developments involving a synthetic swab. Can you tell us about that?
Yeah, so basically, when you look at the testing, we're hearing about blood tests, we're hearing about nasal swabs, now we're hearing about saliva tests. And when you talk about the swab, remember that there are a lot of pieces in the test kit. In order to ramp up production and make these tests basically as accessible and available as a home pregnancy test, we need to study different materials so that one part of the kit doesn't go into short supply. So that's what you're seeing here. Could it be used at home eventually? That's what they're looking at. But with any kind of test, remember, it not only has to be accessible and cheap, but it has to be accurate. So that is all being looked at now.
That's really important, Doc. Thank you so much.